I'm a psychiatric nurse by profession. Actually, I'm one of those who started mental health services in Kitgum. By the time I joined services in 2001, there was no mental health services, especially the department was not existing. When I was recruited in 2001, we decided now to run mental health services. And by then we had a small room in OPD, room 14, that is where we were operating from. And from that time we started making sensitization to communities to create awareness about the existence of mental health services in the district. And currently we are having a very big department. We have migrated from room 14, which is a single room, to a ward and OPD services. We currently are having different types of mental problems that we are handling. We are handling nodding syndromes, we are handling epilepsy and other mental health problems. Coming back to your question, what are we doing about the very many mental patients in the district or in town? As mental health department, we cannot do much as pertaining the existence of these patients in the communities or on the street. First of all, mental health itself, it is under Constitution of Uganda. And all these patients you see around are being guarded by the Constitution of Uganda under Mental Health Act of 1965. So that act specified very well that any person with those patients are being protected by the Mental Treatment Act, and they have full right to be in the communities. And we cannot just move and pick them as department, although we may feel we should manage them, but because of that constitution specifying that these people have their rights, we cannot do much. And you have been seeing us carrying them going to Puerto Rico. That is under the directives of either relatives or from the RDC. But beyond that, we cannot hunt for these patients in the communities, because we are also protected by the law. That is Mental Treatment Act. Epilepsy, also sometimes we call them nodding syndrome per se. Nodding syndrome is part of epilepsy. Actually, epilepsy is the bigger part of it, but nodding is a bit the sister to epilepsy. We currently managing this kind of people, and when you come to our clinic, you realize the majority of patients that we manage in this department, they are basically epileptic patients. And you will realize that most of these children who were having nodding syndrome, for now they are all having epilepsy. They have advanced. The disease has become complicated. Being patients with nodding syndrome, they have progressed with epileptic, they are now having even mental retardation. So we are having 3 conditions in one patient. And when you look at the person as a whole, you may think, as a mental health practitioners, we try to look at these people as a whole. But when we try to manage them as individuals, it is also very difficult to manage these patients, especially when you go back to their respective communities. It is very difficult for the caregivers to help us manage these children as far as drug management are concerned. Because we may give our treatment, we may give our psychotherapy to the families, but we know the background of these people also are diverse. Our communities spend time in the gardens, and by the virtue of the presentation of these children, they look at these children as if people who are not now beneficial to them, and therefore they just neglect them at home, no drug adherence, and these children are left to burn at home. especially when the drugs have not been taken by them regularly, because they end up getting what we call epileptic status epilepticus, where a person gets repeated intervals of fits without any rest in between. And when such disease occurs while the person is at home, in the absence of a relative or a caregiver, they end up dying. In ideal, epilepsy is not supposed to kill. Epilepsy can only kill a person when you fall from a height, when you drown in water, when you fall on fire, or when you suffocate. But in ideal situation, as the disease itself, as the disease process, a person is not supposed to die as far as epilepsy is concerned. You only get those attacks when your airway is not blocked. You remain alive. But later you develop complications like the mental retardation I'm talking about, because by repeated episodes of attacks, the brain cells are being damaged. And when the brain cells are being damaged repeatedly, this person will end up with mental retardation. Then we have various drugs which we use for management of epileptic patients. One of them is sodium valproate, which was specifically brought during a time of nodding syndrome. We were managing with patients with nodding syndrome, but that is anti-epileptic drugs itself. We have what is called carbamazepine. We have what we call phenytoin and phenobarbital. That is the drugs which are basic, the one we have. But we have others like lamotrigine, which are very expensive and the government may not afford to buy and bring to us. But those are the drugs we have at hand for the management. Thank you.